As COVID-19 continues to claim lives each day, the push to get people vaccinated is still growing, and many are especially worried about children.
That's why companies are quickly working to find a vaccine that works for kids and then get it approved. Driscoll Children's Hospital in Corpus Christi is one of 40 hospitals nationwide participating in the Pfizer clinical trial for COVID-19 vaccine for children under 12 years old.
And once again, we are joined now by Dr. Jaime Fergie, Director of Infectious Diseases at Driscoll. First off, Doctor, thank you very much for being with us. I know you got to be excited today because Pfizer says that their vaccine for kids between 5 and 11 actually works. Your reaction?
Absolutely delighted with this news. And as you know, we have been part of this effort, this international effort to get this vaccine approved for children. Of course, this is just the initial step. You know, the information is available. Pfizer released data indicating that overall, when putting all these children together, it was safe, and the responses that the children between 5 and 11 produced were as good, if not better, than the responses in terms of antibodies than the adolescent and the younger adults produced.
So we know the dosage is the big difference between that vaccine that the adults have been getting and compared to the children. So what have been parents telling you about their concerns with this vaccine?
Well, you're right. The dose is 1/3, so 10 instead of 30 micrograms for the vaccine. And, you know, I think the parents that we have had here have been very enthusiastic. They wanted the child to participate in the trial because they want the vaccines. So I think parents in general have the same concerns that everybody else have in terms of safety. They want to be sure, you know, the vaccine does what it's supposed to do, that it doesn't have any special side effects or that we haven't seen. And the truth is, with the study so far, we have seen only the common reaction, the swelling, the pain, the redness, some headache and malaise, but nothing out of the ordinary. So we can reassure parents, for all we know right now, the vaccine is safe between the ages of 5 and 11. Of course, the Food and Drug Administration have to review the data, and they are the one who will issue an emergency use authorization if they agree with this assessment.
Of course, Doctor, with a lot of studies, people are always kind of concerned about numbers, how many people were actually in the studies and what was the effects to those people. So as far as your hospital and the kids that you were looking at, how many kids were in your study? What were some of the reactions that they had? And then are you confident that that was enough to kind of get Pfizer disapproval from the FDA?
Well, yes, certainly. So, for example, locally here, for that group, we more or less include about 50 children. And again, I want to say thank you for the San Antonio community who have participated, have driven here to Corpus. So we're glad for that. Now, in terms of what we're seeing, we didn't see anything particularly concerning. We saw just the common reactions, and I think that that is good. Now, how many children? You know, the FDA asked for more, so we're working on adding more children to the study. But this initial number is, I think, enough to reassure people that the vaccine is safe. And I think the FDA will likely, but I'm not sure about this issue, an emergency use authorization for this vaccine.
What about the level of the immune response? We know it's showing to be protective for the kids. So would they have to get a booster shot in maybe 6 months or maybe even a year?
Well, you know, I think it's a little too early to say that. We are delighted with the fact that these children are receiving the vaccine right now, 2 doses, and I think that will be good for quite a while. If they need a booster, we'll find out later. But the responses, the antibody, what we can actually measure in those participants, results were very good, were as good, in sometimes perhaps even better than some of the numbers seen in adults.
Now, I know you obviously have been working with a lot of kids in your hospital down there, but of course the FDA came out the other day and said they weren't ready to approve boosters even for adults. Do you have any kind of insight into that, and do you have any kind of reaction to them saying no to boosters, at least for right now?
Well, you know, I think you have to, first of all, understand it's not like there's something wrong or any concern with giving the boosters. It's more trying to decide, are they really needed for everybody? So we know that the vaccine provides protection, that it lasts for a while in terms of providing prevention for hospitalization, going to intensive care unit. but we have seen a decrease in the overall protection in terms of just getting sick with the virus. And the issue is it worthwhile to give a third dose for everybody, or should we just focus on the people who are, who don't respond as well, those over 65 and those with underlying medical conditions? My impression is it's just going to be a matter of time that more and more people will have a recommendation to get a booster shot.
Doctor, once again, we want to thank you for your time. We know you're very busy down there in Corpus Christi doing all this research, COVID-19, but we appreciate you taking the time to give us an update on this Pfizer vaccine and how it's going to be affecting the kids. And I know a lot of parents are paying attention because a lot of parents are worried about their kids in school, the masks and the vaccines, and there's just so much going on with this. So we appreciate your time and we appreciate your effort in all this research you're doing. And we'll look forward to talking to you again real soon. Thank you, Doctor.
Thank you, Doctor.
Thank you very much. Thank you.